Angela Probscart, and I'm going to be going over a presentation of pharmacology in relation to mental health. The objectives and purpose are to talk about medication management for mental health and the primary, secondary, and tertiary and alternative interventions for certain mental health disorders such as anxiety disorders, bipolar and mood disorders, personality disorders, schizophrenia, spectrum disorders, and trauma and adjustment disorders. I'm also going to briefly review the National Association of Social Work Ethics and limitations on medication and how medication doesn't necessarily solve everything, and alternatives to medication. And at the end, you'll find references to what I'm talking about. So again, here are the objectives. And mental health disorders are a leading public health concern and are in the top 10 causes of profound reduction in disability-adjusted life years. Psychiatric physicians commonly prescribe medications as the primary way to prevent and treat mental health disorders. And some of the medications cross over to different disorders and different types of disorders. There are treatment approaches for mental health that So here you'll see the descriptions of the treatment, primary treatment, secondary, tertiary, alternative. And primary is usually before the onset or just at the onset. Secondary is treatment right after the onset. And tertiary treatment is treatment for the ongoing symptoms. But it's also referred to in this presentation as the primary course of treatment, the secondary course of treatment, tertiary course, and alternative. A lot of times alternative treatment is not even considered as a primary treatment. And that's kind of a problem sometimes, especially where individuals might be against big pharma. So they don't want to take medicine. And as a result, they suffer from their disorder. So we're going to first talk about anxiety. And the primary medications are SSRIs, which are selective serotonin reuptake inhibitors. And they give serotonin to the neurons. They're absorbed in the neurons, and then the person gets more serotonin. So that helps them with the anxiety. The serotonin norepinephrine reuptake inhibitors are primary, but not as common. Secondary medications are benzodiazepines. They have rapid short relief. And then tertiary medications are more for sleep and calming. And then the alternative alternative medications, or excuse me, treatments are GABA enhancing dietary supplements, but also GABA enhancing practices such as mindfulness, yoga, meditation, things like that. Bipolar and mood disorders use medications such as lithium, lamotrigine, valproic acid, antipsychotics, quetiapine, olanzapine, risperidone, aripiprazole, and ziprasidone. These medications work with some chemicals that help with regulating those disorders. Ketamine is used for depression, but it also can help with some of these disorders. as secondary treatments. Dialectical behavioral therapy is also a great treatment for these, an alternative to medication. I think it's better though used with medication, but it depends on the person, of course. And then alternative can be mindfulness meditation and yoga. Personality disorders use similar medications to anxiety and depression, such as sertraline, which is Zoloft, fluoxetine, which is Prozac, risperidone, Risperdal, and quetiapine, which is also known as Seroquel. So this secondary could be other antidepressants and mood stabilizers for personality disorders to help with the symptoms. And alternative again. So dialectical behavioral therapy and cognitive behavioral therapy help with personality disorders and helping the person understanding themselves better and being more self-aware. Schizophrenia spectrum disorders have to, or typically are only help with the primary medications such as Abilify, Zyprexa, Seroquel, Risperdal, clozapine, which help with the different symptoms that they have. Secondary could be antidepressants and mood stabilizers. Tertiary could be long-acting injectables. The long-acting injectables are a good alternative simply because the person doesn't have to remember to take the medicine. That's going to last for weeks or a month, possibly months, 6 months at a time. They're developing more and more modern treatments to these. And additionally, alternative non-medicinal treatments for schizophrenia spectrums are mindfulness, also art therapy, music therapy, and yoga. Some of the other alternatives also help with this. Trauma and adjustment disorders could use some of the same medicines, simply because they're calming to the mind. As primary ones are aripiprazole, Abilify, olanzapine, quetiapine, risperidone, clozapine, all of the same. Eye movement and rapid desensitization help with trauma. Also, psychotherapy in general can help as a tertiary treatment. Trauma, yoga, and polyvagal theory is very good at helping to regulate the nervous system better and use some of the exercises in there to change how a person feels. The National Association of Social Workers interacts with individuals, families, and groups in accordance with the National Association of Social Workers Code of Ethics. And responding to individuals in a cultural way that is respectful to them, understanding how they might feel about pharmacological approaches. They might be against that, and that might be a challenge for them to stay medicated or to receive medication at all. So applying alternative approaches for them is within the spectrum of helping individuals and showing them dignity and respect. So again, interacting with families and groups without bias and just understanding them, what's going to benefit them the most. And here are the references. And thank you very much.